Hello students, welcome to MOOC's program on drug therapy of shock. This is first topic of unit 2nd of subject Pharmacology-II and subject code is BP 503T. Myself Gitika Mehta, assistant professor in pharmacology at Rajkumar Goel Institute of Technology, Pharmacy, Ghaziabad. So, in this we will study about different types of shock. In this we will study different types of the shock, management of the shock and what are the different stages of shock. So, to begin with, first we will understand what is shock. So, shock is a state of acute circulatory failure associated with underperfusion of the tissue, and inadequate tissue perfusion leads to generalized cellular hypoxia, impaired cellular metabolism, tissue damage that will further lead to multiple organ failure and death. So, what does it mean acute circulatory failure? So, shock is a generalized inadequate blood flow throughout the tissue, throughout the body. So, when there is inadequate blood flow, then there will be the reduced blood supply. Reduced blood supply will result in the reduced oxygen supply, and reduced oxygen supply will result in the depressed functioning of the tissues and organs. So, that will result in the multiple organ failure and ultimately it will lead to the death. So, going further, now what are different types of the shock? So, based on the causes, shock can be classified as hypovolemic shock, septic shock, cardiogenic shock, anaphylactic shock and neurogenic shock. So, next is what is pathophysiology of shock? So, pathophysiology of different type of the shock is almost same, because in all the shock there is the underperfusion of the tissue. Because of the underperfusion, reduced oxygen supply, and reduced oxygen supply leads to that cells switch from aerobic to anaerobic metabolism, and because of anaerobic metabolism there is increased level of the lactic acid production, cell function ceases and cell will swell, membrane become more permeable and electrolytes and fluids seep in and out of the cell, that is their electrolyte imbalance will occur. Sodium and potassium pump is impaired and which will further lead to mitochondrial damage and cell death. Now, because of this, body's internal regulatory activities, regulatory mechanism will activate to make body recover from the shock. So, for that various compensatory mechanism gets activated. So, inadequate systemic oxygen activates autonomic response, and in this there is the activation of the sympathetic nervous system, there is activation of the renin-angiotensin system. Now, as soon as there is reduced oxygen supply, reduced blood supply, so decrease in the cardiac output. Decrease in the cardiac output, decrease in the blood volume and blood pressure will be sensed by baroreceptors, and this baroreceptor stimulation will further activate sympathetic nervous system, and sympathetic nervous system activation will lead to discharge of release of norepinephrine, epinephrine, dopamine and cortisol release. So, this further causes increase in heart rate, increased contractility, vasoconstriction and increase in preload. Reduced renal perfusion also activates the renin release. renin release from the JG cells of the kidney. Renin will, through the renin angiotensin system, will cause release of the angiotensin 2, will cause the release of the angiotensin 2. Angiotensin 2 is potent vasoconstrictor. It is potent vasoconstrictor. It releases aldosterone from the adrenal cortex that would result in the sodium water retention and increase in blood volume and BP. So, whenever body is under shock, so body's internal regulatory mechanism will activate to recover it from the shock, but when this compensatory mechanism will fail and when the shock is still there, then patient will further progress into the irreversible shock. So, what are the different stages of shock? So, shock basically we can say there are the 3 stages of shock. Number 1 is compensatory, number 2 is progressive, and number 3 is irreversible shock. So, as we have discussed, in initial stage when tissues are under perfused, decrease cardiac output, increase anaerobic metabolism, lactic acid production, so cell function reduces. So, compensatory mechanism, various compensatory mechanism will activate like sympathetic nervous system activation, baroreceptor stimulation and renin angiotensin system activation. So, these compensatory mechanism become overwhelmed and resulting in tachycardia, tachypnea. Tachypnea is faster breathing, metabolic acidosis, oliguria means reduced urine output, cool and clammy skin. Now, but if this condition worsens, then the patient will go further into the compensatory mechanism will fail and patient will go further into the irreversible shock if external intervention is not given. If the external treatment is not given, then this with the loss of 20 to 25% effective blood volume, compensatory mechanism will fail and eventually irreversible shock or multiple organ damage will happen that would lead to the death. Now, one by one we will understand the mechanism of different type of shock and general management. So, first in this is hypovolemic shock. Now, hypovolemic shock is a life threatening condition in which there is more than 20% of the fluid loss or blood loss, and it makes difficult for heart to pump enough oxygen, enough blood to the whole body. So, hypovolemic is a life threatening condition because there is a decrease in intravascular blood volume. There is decrease in intravascular blood volume to such an extent that effective tissue perfusion cannot be maintained. Effective tissue perfusion cannot be maintained. So, hypovolemia results in decreased venous return and that further results in decrease in the preload. Decrease in preload results in decrease in cardiac output that will further reduce BP, hypotension, and that results in the perfusion failure and tissue hypoxia. And if left untreated, it will lead to the organ dysfunction, multiple organ failure and death may occur. Now, hypovolemia, in this there is decreased blood volume and this decreased blood volume. So, there are the different causes of hypovolemic shock. It can be because of the acute blood loss, this acute blood loss or acute plasma loss. So, blood loss can be because of the hemorrhage like in accidents, Because of the burns, there is the loss of the plasma, dehydration, that is severe vomiting and severe diarrhea. So, this may result in the loss of the extracellular fluid and diabetes insipidus. So, because of these causes, it results in the decrease in intravascular blood volume. Decrease in blood volume will result in the decrease in the cardiac output, and decrease in the cardiac output will result in the fall in the BP, and reduced tissue perfusion will result in the tissue damage and multiple organ failure. So, what are the clinical signs? Clinical signs of hypovolemic shock are tachycardia, that is increase in the heart rate, tachypnea, increased abnormal breathing, weak and thready pulse, hypotension, cool and clammy skin, and decreased urine output, which is known as oliguria. Now, how we can treat or manage hypovolemic shock? So, treatment or management of the shock is almost similar. So, here management objectives of the hypovolemic shock are to increase cardiac output and to increase tissue perfusion. For this, fluid and electrolyte replacement is key for all types of shock. Also, we need to correct acid base disturbances, blood product replacement, ventilator support for oxygenation, adequate urine output should be there. So, urine output is monitored, there should not be oliguria, and vasopressors if required, that is to increase the BP. So, this is how we can prevent or we can treat hypovolemic shock. So, next type of the shock is septic shock. Next type of the shock is septic shock. It is a life threatening condition caused by severe bacterial infection. Septic shock is a life threatening condition caused by severe bacterial infection. It further results in organ failure and dangerously low blood pressure. This is the most common cause of death in ICU, intensive care unit. This is the most common cause of death in ICU. So, what are the symptoms? It basically occurs in two phases, warm shock and cold shock. So, there is a high fever during whenever there is infection. So, first symptom is first sign is fever. So, early phase, that is known as warm shock, there is a high fever and vasodilation, and in cold shock late phase, that is the decompensated state. So, progressive clinical signs are systemic vasodilation and fall in BP, that is hypotension, tachycardia, decreased force of contraction, decreased contractility, high fever, disseminated intravascular coagulation, respiratory distress and multiple organ failure. So, how does this septic shock progresses? So, this septic shock is initiated by bacteria. Bacteria gram negative, most commonly bacteria, it is gram negative bacteria it is caused by, and cell wall of these bacteria releases toxins. Cell wall of the organisms releases toxin. These toxin enter inside the body and enter inside the cells and release inflammatory mediators interleukins, prostaglandins, tumor necrotic factor alpha, platelet activating factor and cytokines. So, because of the release of these toxins, they are the release of the inflammatory mediators, and these inflammatory mediators will cause inflammation, like vasodilation, increase in the capillary permeability, and which will further lead to the alteration in peripheral circulation, fluid loss and extensive tissue damage and shock. So, why do sepsis occur? Sepsis occur because of the infection by microorganism and mostly by gram negative bacteria which enter inside the body, releases endotoxins. Endotoxin releases the inflammatory mediators. Various inflammatory mediators results in the inflammation, vasodilation, increase in capillary permeability, and that will cause extensive tissue damage and that will worsen the situation. So, how can we manage septic shock? So, septic shock, for this either we can treat shock, treatment of the shock and treatment of the infection, both are required in this because it is caused by the bacterial infection. So, treatment of the infection is also must in this. For this, to treat the infection, broad spectrum antibiotic is given. So, treat the bacterial infection, we administer broad spectrum antibiotics, and to treat the shock we need to correct acidosis, blood volume, and we also try to maintain the blood pressure. For this we can give vasopressor agent to increase the BP, also fluid replacement and mechanical ventilation for the oxygenation and steroids, because steroids are also anti-inflammatory nature, they increases the reversal of shock. So, that was septic shock. Next is cardiogenic shock. So, cardiogenic shock is a condition in which heart suddenly fails to pump enough blood to meet body's need. As a result, blood pressure falls and organs may begin to fail, In cardiogenic shock, cardiac activity is reduced, and this cardiac activity is reduced because there is a pump failure, and this pump failure results in the reduced cardiac output. And this cardiac output, reduced cardiac output, it may be due to myocardial infarction, it can be because of the chronic CHF, congestive heart failure, cardiac arrhythmia, pulmonary embolism, cardiomyopathy, valvular dysfunction, etc. So, these are the different causes which may result into the cardiogenic shock, which causes the pump failure and reduce cardiac output. Now, what does happen because of this failure? So, heart will be unable to pump adequate blood supply to body, that will result in the decrease in cardiac output, decrease in BP, increase in heart rate because of the activation of sympathetic nervous system, which is the compensatory mechanism. So, release of the epinephrine and norepinephrine because of the activation of sympathetic nervous system. So, increase in heart rate and increase venous return. So, BP and tissue perfusion is restored temporarily because compensatory mechanism work for some time, and if patient condition does not improve, if shock is still there, then the oxygenation to heart further decreases and hypotension and more myocardial ischemia occur and further decrease in cardiac output. So, there is a vicious cycle develops. So, this vicious cycle, to terminate this vicious cycle, we need an intervention from outside. External treatment is required so that we can recover body from the shock. What are the clinical signs? So, of the cardiogenic shock are confusion, anxiety, sweating and cold extremities, coldness of hand and feet, rapid but weak heartbeat, low urinary output, fatigue, chest pain and shortness of breath. So, how can we manage cardiogenic shock? Like in acute myocardial infarction, in congestive heart failure, we can give sublingual nitroglycerine 0.4 mg every 5 minutes till pain subsides. So, maximum 3 doses can be given at a time. So, relief of the pain for morphine injection can be given to relieve from the pain. Of course, maintenance of blood volume and the tissue perfusion, that is required in all type of the shock, oxygen supplement, antiplatelet therapy. For this aspirin is given to maintain the patency of the arteries, so that it will dissolve the clot, thrombus. Treatment of the hypotension, for this we give the inotropic increases the contractility like dopamine and dobutamine, also intravenously furosemide to maintain the blood volume. Correction of acidosis is done by sodium bicarbonate infusion. So, next is neurogenic shock. So, neurogenic shock, it results from the loss or suppression of sympathetic tone, leaving unopposed vagal tone. What does it mean? That during the neurogenic shock, because of it can be because of spinal cord injury, severe head injury, spinal anesthesia, spinal shock. So, because of this, there is a sudden withdrawal of sympathetic nervous system. There is the sudden withdrawal of the vasomotor tone, and that sudden withdrawal of sympathetic nerve would result in unopposed vagal tone, that is activation of parasympathetic nervous system, activation of parasympathetic nervous system, and this parasympathetic nervous system would result in absolute vasodilation throughout the body, absolute vasodilation throughout the body. So, it results in venous and arterial vasodilation that will decrease venous return, there would be decrease in the stroke volume. So, further there will be decrease in the cardiac output. So, activation of parasympathetic nervous system results in fall in BP and decrease in heart rate, that is bradycardia. So, these are the causes of neurogenic shock, and that we have already discussed: spinal cord injury, severe head injury, spinal anesthesia and spinal shock. So, what are the features? Clinical features are hypotension, bradycardia, warm and dry skin and loss of spinal reflexes. What is the treatment? We need to maintain the BP, maintain plasma volume by intravenous fluids, vasopressor, noradrenaline is given to improve vascular tone. So, this was neurogenic shock, in which there is loss of vasomotor tone, loss of sympathetic tone results in activation of discharge of parasympathetic nervous system. Last in this is anaphylactic shock. So, anaphylactic shock is severe systemic allergic reaction. It is severe systemic allergic reaction. So, it is type 1 hypersensitivity reaction. Remember this, it is type 1 hypersensitivity reaction, which is immediate type of hypersensitivity reaction. It is characterized by severe allergic reaction in response to allergen, This allergen can be drug, it can be food, it can be any chemical or insect bite. person hypersensitivity, person sensitivity to various allergen varies. So, it depends upon the hypersensitivity or immune response of the patient. So, as soon as allergen release antigens in the body, whenever there is an insect bite or whenever there is exposure to the any drug or food or chemical, these allergen will release antigen in the body. Antigen reacts with antibody on the surface of mast cell. This is the mast cell, there the antibody is present and antigen will form complex with the antibody on the surface of mast cell. Then there will be the degranulation of mast cell. There will be the degranulation of mast cell. So, release of the inflammatory mediators. There will be release of inflammatory mediators like histamine, prostaglandins and leukotrienes. So, these inflammatory mediators will increase the capillary permeability, they will cause redness, they will cause itching and swelling. So, because of the increased capillary permeability and inflammation. So, what are the clinical features? They causes skin reaction, itching, flushed or pale skin, redness, hypotension, that is reduced in the decrease in the blood pressure, bronchospasm, that is constriction of the bronchioles, bronchoconstriction, that will result in difficulty in breathing, that will result in the difficulty in breathing. And also there will be weak and rapid pulse, nausea, vomiting, diarrhea, dizziness and confusion. Now, what is the treatment of anaphylactic shock? So, adrenaline in this case is a life saving drug. Adrenaline is a life saving drug which is physiological antagonist of histamine. Histamine is inflammatory mediator. So, for this we give 0.3 to 0.5 ml of 1:1000 solution injected intramuscularly. Also, we need to maintain the airway. Because of the bronchoconstriction, we need to give bronchodilator, which is salbutamol. Salbutamol is a bronchodilator which is beta 2 agonist, is given to relieve bronchospasm. Foot end of the bed to be elevated, head to be lower, head should be at the lower level, so that foot end of the bed to be elevated to improve the BP. Plasma expanders or vasopressors, they are also given. Hydrocortisone IV given, which improves the rate of reversal of shock, because corticosteroids, they are anti-inflammatory as well as they reduces the allergic reactions. So, in this we studied different types of the shock. What is the pathophysiology of the shock? What are the different stages of the shock and how we can manage different types of the shock? So, thank you all.